And the Health Secretary, Matt Hancock, has confirmed, as we were mentioning there, that Public Health England will be replaced with a new body specifically tasked with protecting the country from pandemics. He's asked Baroness Dido Harding, who currently heads NHS Test and Trace in England, to take charge of the new body, which will be called the National Institute for Health Protection, NIHP. Well, I'm joined now by Professor Maggie Rae, President of the Faculty of Public Health. Very good to talk to you, Maggie Rae. Well, I mean, are your thoughts then with the many public servants who've been working tirelessly, one imagines, over the last 6 months or so for Public Health England, who are now effectively being told by the Health Secretary haven't been doing well enough?
Yes, as you can tell, it's been shocking news, and I think the way in which it was done was probably the biggest part of the problem, because it's very good of you, Dermot, to recognise the dedication of these public health staff, all the staff in Public Health England. But of course, they are working with local directors of public health, and you rightfully say it's a 7-day-a-week, 24 hours a day operation, and they really have done an amazing job. So I think I was pleased to hear today the Secretary of State thank those staff and recognise that the way in which they found out was unacceptable, and to recognise that we will be part of the system going forward. All the public health professionals involved in those agencies will be required and will be needed as we try and set up these new agencies. And I see my job as President of the Faculty to be there, both to hold government to account, but to make sure that we get what was promised, much more investment in public health and a truly excellent service. Interesting
what you say there. So in effect, a bit of a rebranding issue, given that there isn't another whole team to bring out here. It's going to be many of the same professionals involved in all this, but it is going to involve disruption at a time of crisis. Is now the time to be doing it?
Well, I think that's one of the troubling aspects of this, because I'm one of the presidents that's part of the Academy of Royal Colleges. And several months ago, we wrote to the Prime Minister and offered our services to do a rapid debrief on the areas that could be improved in relation to the pandemic. And I'm sorry to say that offer wasn't taken up. But like most professionals, our public health staff throughout England will be working again tonight, and we will do everything in our power to support them to make sure that we salvage the best of the system and that we continue to put the health of the public first.
Well, let me interrogate some of that, because you did say that PHE, as was, had done an amazing job. Now, for some time, the government has been saying it doesn't think that that is the case, and in particular, this issue of testing and now tracing as well, and the issue of protective equipment. Has it really been amazing?
Well, that is the phrase I've used, and I think some of what I'm hoping to see in the new arrangements is the clarity and the clear understanding and responsibility for who's responsible for what. I think there's a lot of confusion. I know I'm not a cynical person. Some people may think that's deliberate, but genuinely, if we can get a set of organisations going forward that work in harmony together with a clear line of sight about responsibility. And if I could just make the point, Dermot, about the funding, my understanding of the test and trace system, the new system that Baroness Dido Harding has set up, has a budget, I've been told, of £10 billion. The entire budget of Public Health England is 300 million. So it's a bit of a David and Goliath story, isn't it?
And you mentioned Baroness Harding there. I mean, some discussion about her not having a scientific or indeed medical background. Do you think that's necessary, or do you just need that chain of command, clear leadership?
Well, I can honestly say I don't know Baroness Harding very well. In fact, I've only ever met her once. And what did impress me about her is that she had the humility to say she wasn't a public health expert and to say that she would need to do her job in leading the test and trace, all the efforts and the experience and the knowledge of those public health experts to deliver the service. So I can only commend her for that humility, but we do need to make sure that there is a better service. There's no point in disestablishing a public health agency, and I think Public Health England would be the first to say that if they feel they haven't achieved the standards that they wish, or things were not done in the way that they could have been done with hindsight, I think they'd be honest enough to say that. But what we do want is not one agency disestablished and not get what we've been promised, which is an even better service.
Well, Professor
Rae, more effective.
I'm sorry, we are out of time. Professor Rae, thank you very much indeed for your insights. They're very good to talk to you. Maggie Rae there from the Faculty of Public Health. And you